Thanks very much, Sandra, and good morning to everybody. And thank you again for allowing me to present some of my findings today. So the title of my presentation is COPD and Compensation Claims. Every miner has this story. And this is just one of the articles that I completed as part of my PhD. So just a little bit of a disclosure. I am a member of the Center for Research in Occupational Safety and Health. And as Sandra mentioned, I do work at NOSM University. I'm the director at Learner Support Services. So really, when we think about the rationale for this study, when we look at the background, literature talks about the primary cause of COPD, which includes long-term exposure to lung irritants. And the primary irritant is tobacco smoke. However, the studies have shown that occupational exposure, so organic, inorganic dust, chemical agents, fumes, and quartz are also associated with the development of COPD. So when we think about occupational exposures, research has shown that whenever people are inhaling airborne dust at work, there's a risk for occupational disease. So hazardous dust in the workplace includes stuff like mineral dust from the removal and processing of minerals, metallic dust, other chemical dust, pollens, molds, and spores. And so in 2019, the Global Strategy for Diagnosis, Management, and Prevention of COPD, the report included occupational dust, organic and inorganic, to be among the risk factors for COPD in development. So we can see that, that it's starting to be recognized. It does remain essential that an occupational history be taken for all individuals assessed for respiratory diseases. And so what is the impact? So when we were thinking about impacts, we were looking at the psychosocial, the occupational, the financial, and the physical impacts. And so we know that COPD does cause physical and mental suffering. It impacts the patient's quality of life. It limits their functions within their family, and it really influences the whole family's functioning. And a significant element of the COPD patient's management is the disease severity, so which really influences the patient's progress and their quality of life and the limitations and life of activities. And so within workers' compensation, COPD is classified as an occupational disease, which is included in the long latency WSIB illness claims. Workers' compensation claims are a source of data for occupational diseases in Ontario, and are used to monitor and track hazardous exposures in workers exposed to high hazard occupations such as mining. Occupational COPD is likely underdiagnosed and undercompensated, therefore underrepresented in the data that is provided by WSIB. So my research objectives were to explore the impact, and I've already talked about that, of COPD on underground workers in the minerals industry in Northeastern Ontario, to describe mineral workers' experiences with the Ontario Workers' Compensation Claim process, and to describe physician and union compensation representative experiences with those underground mineral workers who were diagnosed with occupational COPD and their experiences with the WSIB claim process. So I used a qualitative narrative study design. I had 16 underground mineral workers who participated in my study. My workers were represented across Northeastern Ontario, so from Sudbury, Timmins, Kirkland Lake, and Matachewan. I also had the good fortune of interviewing workers' compensation reps, as well as physicians who were involved in diagnosing COPD as an occupational disease. I conducted I conducted in person, but it was COVID. So I actually conducted all of my interviews via telephone, and they were semi-structured interviews. And I did use Brown and Clark's thematic analysis to analyze my data. So what were my research findings? Well, COPD is exhausting. They couldn't breathe. I smoked, but I did not think I could get compensation. The compensation process is a joke. We need people to fight for us. Working in the mine is a dirty job, and we didn't know any better. And doctors do not know anything. And I'm going to go through each one of these separately. I'm just keeping an eye on the time. So the first one was results. The COPD is exhausting. So some of the quotes that came through, one of the workers said, "I go shovel some snow and I have to stop. I hold the shovel and I look around and people think I'm just looking around, but I have to stop because I cannot breathe." Another worker said, I stopped hunting and fishing. I stopped doing everything because I could not breathe. I could not get enough air. And another worker said to me, just having a shower takes my breath away, and I have to sit down for 15 to 20 minutes just to catch my breath. When they talk about I cannot breathe, one of my workers said, I do not have enough air. When I'm talking to you, I have to take a deep breath just to talk to you. I run out of breath easily. Breathing is the hardest thing. I just have a hard time breathing. Being out of breath all the time, you can't breathe. It's like having an elephant on your chest. Another worker said, like you have no strength when you have no oxygen. Trust me, it's not a fun thing. Everything is a pain in the ass. It's not a fun disease. What was interesting was, all of the workers said, well, I had no clue that I could claim compensation, because certainly when they were, visiting with their physicians to talk about COPD, always the first question was, well, did you smoke? Therefore, you can't claim compensation. So it's still that, that misnomer that physicians really didn't want to attribute the fact that they had been exposed for years to so much dust and minerals while working underground. One of the workers said, I wasn't even thinking about compensation for my COPD. When I told my nurse practitioner that I was going to submit it, she said, that's fantastic. It had never come up in conversation with my doctor about submitting a claim to compensation. Another worker said, cigarettes were the answer, and there was no going either way. Cigarettes were the problem. Another worker said, well, the doctor asked me what kind of work I did. And she said, well, you work with lots of equipment. And I told her yes. And she said, well, that didn't help. And she asked if I smoked, and I said yes. And she said, well, your smoking did not help. And that's your number one contributor to your lung disease. We talked a lot about the compensation process. What did that look like for them? One worker said, as far as I'm concerned, it's a farce. It's a joke. I had a hard time getting my claim approved because doctors did not want anything to do with the compensation. And if you did get a doctor to complete the form, you went through a lot of bull. I just get pissed off thinking about it. It's not easy for anybody. It seems that if you have something legit, it does not work. But if you're a phony and you know the ropes, you get approved. Another worker said, I fought for my compensation claim. I was rejected. I told the case lady at compensation, I didn't care. I have good people who are going to help me. And every time I've been rejected, I've fought and I've won. And I'm going to beat you too. I'm not letting this go. They scare people off with their tactics so they don't have to deal with them. Sadly, it comes down to that. Compensation says, I wasn't exposed enough. Well, how exposed do you have to be? I worked in the mine for 22 years. Do you have to die in order to be compensated? So when we look at, the fact that what they were really looking at is they need advocates. And so one of the workers says, you don't dare fight the big companies. They always have better lawyers than you do. You would not dare fight. Then another worker said, if you don't have a doctor who protects you, you're a dead fish out of water. You'll never have a leg to stand on. If you have a good representative, then they'll fight for you. You have to find a good doctor who's going to acknowledge your position. Otherwise, you don't stand a chance. Everything needs to be documented. If your doctor is not on your side, it makes a big difference if they are willing to fight for you. And then what we talked about was, what does this look like? So when we reflect back on the fact that literature has showed us that working in the mine and the exposure does add to COPD, one of the things that we talked about as part of this research was, what did it look like when they were working in the mine? And one worker said it was a dusty, dirty hole. When you came up from underground, you would blow the crap out of your nose for 2 days afterwards. It was dark, dismal, and very dusty. And you could smell the diesel fumes all the time. Underground was a hellhole. It was dusty. And when you went home and blew your nose, it was always black. Another worker said, the dust is so bad underground that you have it in your armpits, your groin, and your butt. The grit would get in there and almost scald you like sandpaper. It would be so bad you would bleed. Another worker said, the old miners, we know what we faced. Mining is a tough job, and this job was not for everybody. It's a dangerous job. But when you have no education and you have kids and a mortgage over your head, you have no choice. Now, as for context with some of this information, the participants that I interviewed were all either on disability or retired. So their experiences in the mines were, between, 30 to 40 years ago, which may be a very different experience than what it is now. So results, when they talk about going to the physicians and the doctors who don't know anything. So one worker said, when you talk to a doctor, they don't know anything about working underground. They don't know what it's like to breathe in that stuff. So the doctor does not support me. Another worker said, I was having difficulties. So when I went to see a lung doctor, he said, well, you have COPD. So I said, well, that has to be due to when I worked in the mines because I was breathing in a lot of diesel and dust. And he said, well, are you a smoker? And I said, well, I used to be a smoker, but I quit. The doctor told me that no doctor would say that COPD was due to exposure in the mines. And finally, we get this to our discussion, and I'm just being cognizant of time. So my participants shared very emotional and passionate stories about their experiences as an underground mineral worker who was diagnosed with occupational COPD and the compensation claim process. And what I can tell you is, even though I did telephone interviews, I could hear the emotion coming through in my interviews. And in fact, there was a couple of the workers who actually were quite emotional that they broke down. It was clear that they had similar challenges when dealing with the compensation claim process. So one of my workers said, yeah, I finally got a check, Sherry. It was for $3. And that's what their compensation claim was. It was a check for $3. They were frustrated about a lack of understanding about the compensation claim process, and they felt unsupported by the healthcare system when attempting to document COPD as an occupational illness. We know that taking an occupational history would help identify possible relevant exposures, and the literature has told us this. The importance of somebody who is working in an environment that may add to their respiratory diseases, start that occupational history. Occupational lung illnesses are frequently ignored, misdiagnosed, and misattributed to non-occupational causes such as smoking. We know that living with COPD is a burden for most individuals. These workers who, spent 20, 30 years in the mine, retired. Because COPD is a long latency illness, it's not until they retired or went off on LTD that all of these symptoms started to come to fruition, and their quality of life was just diminished after spending so much time working. Participants did understand that smoking was a significant contributor to COPD. However, they emphatically expressed that they believe working in the mining industry and being exposed to dust and fumes did contribute to their COPD, development of their COPD. There are multiple but little studied barriers at the physician level. Some of these barriers include physicians' attitudes to lifestyle factors, especially smoking, and their perception in the role in occupational health and workload. Smoking status reduced the number of referrals for compensation made by general practitioners, resulting from a lack of understanding that the combination of cigarette smoking and occupational exposures greatly enhanced the occupational respiratory illnesses. Healthcare providers were really only focused on the fact that the worker previously smoked and would not consider occupational exposures as a confounding factor for developing COPD. Many participants in this study really initially faced denial of their compensation claim, and a lot of them were actually still fighting their compensation claim when I interviewed them. I'm just going to move along, trying to be cognizant of the time. So some of the study strengths for my study was, it was the first to explore the experiences of underground workers diagnosed with COPD as an occupational illness across Northeastern Ontario. It had the ability to capture those in-depth perspectives of underground workers who were diagnosed with COPD and who all had direct experiences with the compensation claim process. It does add to the existing literature, providing insight and reflecting on the experiences of underground mineral workers in Northeastern Ontario diagnosed with occupational COPD and the compensation challenges. And what it did was, underground mineral workers and the union compensation representatives and medical participants were really keen on making changes to improve this process from all of their views. So each of them had a different lens that they took this research from. So some of the limitations of my study, I did only collect data from male participants, such that female underground workers could have enhanced the data by providing a different perspective. I had a small sample size, when it came to my physicians and my representatives, worker representatives, the possibility of selection bias from only participants who faced negative encounters with the compensation process. Certainly recall bias, as I indicated, my participants were, where most of them were 65 and older, so they may have difficulty recalling some of the details. Researcher bias, of course, and my study was only conducted in English, and so any of the Francophone, they may have been able to contribute in a different way. So in conclusion, my study does support findings from previous qualitative work on occupational COPD and the compensation claim process experiences. It gives a deeper understanding of previously identified issues of living with COPD and suggests why individuals act in the way they do. It brings awareness that the main challenges for occupational COPD are workplace hazards, the lack of early detection, and the constraints towards recognizing COPD as an occupational disease. It suggests that physicians need to be aware of and report cases about occupational respiratory hazards, so we have accurate data to really think more about some of these studies that need to take place. It identified methods in identifying methods for early detection and monitoring occupational COPD really should be a priority for public health research. There needs to be a revamp of the compensation system where the burden of proof does not rest on the worker's shoulders. There's been so many changes, and some of the information, I'd love to talk to you more about what the physicians shared with me, but they even struggled because the compensation process has changed so much that they didn't have access to physicians that they were hoping to, collaborate with and talk about these diagnoses. And while smoking is a significant cause of COPD, the study contributes to research that indicates that the exposure to hazardous workplace toxins could be linked to the development of COPD. Public health agencies must continue to provide education about the importance of smoking cessation and towards maintaining safe and healthy workplaces. When I was talking with my workers, again, this was years and years ago that they were in the underground environment. And one of my participants said, the employer didn't care what you did underground. You could go underground naked, you could smoke underground, as long as you were producing, they were quite happy. The employer was happy. So I just want to be able to thank the participants who helped make this research possible. I'd also like to thank all of those who supported the recruitment. The local 6500, I did collaborate with Janice Martel from OCAL, NOSM, who helped me with recruitment, and CROSH for also supporting me in my recruitment initiatives. And that's my study. Thank you.
Great job. Thank you for explaining that. I've got a bunch of questions here for you. So I'll dive in and hopefully I'll do a good job delivering them. Okay, so would living in a mining town and having a doctor that's more knowledgeable in these areas and the possibility of claim or living to other areas less versed in mine exposure related illnesses impact the chance of a successful claim, or even knowing that they can make a claim? So I would almost interpret this a little bit as saying, if you live in a northern town, are you more likely to have a doctor who knows what what you're facing, and are you more likely to have a successful claim?
So it's an interesting and really good question. So absolutely. So some of the folks that I interviewed would say, there used to be a doctor years and years ago who was attached to the mining company, and the mining company actually paid for them to be the physician. And so they would be sent normally for a routine chest x-ray, they might do a PFT, and they would follow and track that information. So absolutely, those physicians would absolutely know just by tracking that information and be very closely related to the company that yes, that compensation claim would show that there were changes based on that exposure. So I would say that from my study and from what my participants shared with me, that would be an accurate description of what it would look like living in the north and dependent on where you lived in that mining community. I can tell you that, within the workers who participated in the Sudbury region, absolutely, there was a physician. It was much easier for them to get that compensation claim.
Good to know. Okay, from Mia Hanamaki, she wants to know what the average age of the miners who were diagnosed with COPD. So I think she means what age were they when they were diagnosed with COPD? Do you know that?
Great question. So what I can tell you is this. So my participants ranged between the age of 54 up until about 83. So for the most part, the participants were not diagnosed with COPD until they were later in life. So between their 40s and 50s, again, it's a long latency illness. And a lot of times they didn't recognize that the symptoms had been ongoing for years. So shortness of breath, cough, they were having those restrictions, but they didn't recognize them as COPD. And so what they attributed to was exactly that, the exposures in the mines. I would come home, I would have a cough. This was something that was routine. Maybe I had a chest cold. It wasn't until they started having the functional limitations. They couldn't walk as far as they normally could. They were struggling to do stairs. That all of a sudden they realized that they were having more and more shortness of breath. So it was later in life when they were diagnosed with the COPD, which led them to then submitting for compensation claims much later in life.
Right. Okay, from Manny Kuza, do you think that changes in personal protective equipment and other health and safety equipment in mines have impacted the chance of a successful claim?
So what I can tell you is this. Personal protective equipment for my participants was limited. Again, they talked about, you were very lucky to wear a pair of safety boots and goggles when you were going underground. Personal safety equipment currently now absolutely will support and help to limit that exposure. It'll limit the exposure to what you're taking in from a respiratory perspective. Will it help enhance your chances of getting your compensation claim approved? I don't know that I could say that. I think, again, that goes back to what does it look like? So WSIB has a whole big formula about what it looks like and, how much exposure there is to relative to, your age. There's a formula that's attached to this and what it looks like. What I can tell you was halfway through my study, workers' compensation changed how they will provide a non-economic loss to anybody who was diagnosed with COPD. So in the past, what they did was they would say, yes, you're entitled to a claim, but if you were a smoker, they immediately cut that claim in half. They're no longer doing that. And so that was a win during the course of my study.
That is a win. Interesting. Okay, I don't know if we're going to get through all these. We have 5 more minutes. Let's see. Rita Alzaran, I hope I'm saying that correctly. I'm wondering whether there are any initiatives to raise awareness among doctors that while smoking is one factor contributing to COPD, the environment that underground miners labor in has many other factors as well. So can you speak to any initiatives raising awareness specifically to healthcare providers?
Yeah, absolutely. So there is an initiative with WSIB that works with all of the medical schools. And what they're doing is they have a physician who is dedicated to bringing that curriculum into the medical schools. So it's an initiative to bring that awareness, absolutely, about what that looks like from an occupational lens.
So the younger physicians may get some training, not sure about the older physicians and other healthcare providers. So still lots to do, I guess.
Yeah.
Okay. Jonathan LeMaid Fuentes says, I love that you did that kind of study. Do you know if such studies have been done in construction where I feel it has been neglected and so many people end up crippled? If you know of such studies, can you provide links?
Yeah, so I'm not aware of studies in construction. What I can tell you is there's been studies with other companies. I do know that somebody who is involved with the local 6500 is currently doing a study with those who are, I'm trying to remember the company name. It's a company that does sandblasting. So same type of thing where they're inhaling those types of dust. but I'm not sure about the construction sites. But there's lots of study that speaks to even those who do farming, because the grains, the dust and the grains. So there's lots of different studies that speak to that inhalation of those types of dust as well.
Right. Okay. Are there safety protocols put in place for the miners to hopefully avoid COPD?
So the safety protocols, so the safety protocols are your PPE, and the other safety, really the recognition that, smoking education, smoking cessation education, those are really the protocols that are in place. The enhanced PPE, they do have better ventilation now than they ever have. So there's certainly things that have, changed over the years, but your PPE, the ventilation, the direct ventilation, and certainly education about smoking cessation.
Why do you think that doctors were so against saying health issues like COPD were caused by the mines?
So I think a lot of them were afraid to do this. And in fact, one of my workers said that it had a lot to do with that if a physician actually said that, yes, the mining company contributed, those toxins contributed to COPD, back in those days, perhaps they were attached to the mining company and the mining company may not continue to employ them. So I think there's a lot of bureaucracy that was attached to that and what that looked like. There was also concerns about their licensing. What did it look like if they made a claim? They'd have to substantiate that. Would they be the only ones with WSIB who would say, yes, this is what it looks like? Don't forget, if one physician and another started making these claims, then that changed the whole trajectory. So I think it had a lot to do with bureaucracy. It had a lot to do with, they were very small communities, and those physicians, a lot of them were attached to the mining communities in those the mining companies in those communities.
Okay, so it's 1 minute to 11:30, which is when we're taking a lunch break, but there are a few more, there's about 5 more questions. Do you have time to stick around, Sherry, if we entertain more questions? Yes? Okay, so if you're interested in listening and you can do so, we're going to answer some more questions. But otherwise, we are officially on lunch break. Please come back at 12 o'clock. Where Dr. Carrie McGannon will kick us off talking about some work-life balance issues. Okay, so Sherry, Jordan Reed wants to know, did you find a difference in access to compensation between union and non-union workers?
Yes, great question, Jordan, thank you. So a couple of my underground workers were on contract, so they weren't necessarily part of the union. They struggled more because they didn't have union backing to support them in guiding them through submitting those compensation claims. What I can tell you is this, that the union compensation representatives really supported those who are getting those claims, because the documentation is so onerous for the worker to complete, and they needed to ensure that the information put on those forms was very clear and the language was very clear. A non-union person really struggled without the support of a union compensation representative.
Denny Choi would like to know, what are your future steps based on your current research findings?
Yeah, so I hope to continue working with WSIB and workers' compensation. I've certainly done in the past. My master's was also involved with compensation and compensation claims. So I hope to continue this work to bring this to fruition. Again, working with Janice Martel, she's done a ton of work, and working with more of the union compensation reps to really bring this to the forefront. So I continue to advocate to try to get this information to WSIB.
And I think if I can add on to that, I think there's efforts too to further support the link between the components of mining,
absolutely,
dust and diesel in particular, to back up the claim. So again, you may see better support down the line. Okay, and Rita Alzeron would like to know, do you think the shortages of medical staff has an effect on the compensation claim when workers meet physicians?
So it's an interesting question. I can respond to it by saying that my physician participants in the study found it very difficult and did not enjoy completing compensation claims at all. It's very difficult. The files go out, the files come back, the files go out, the files come back. So there's constant challenges with this back and forth. The compensation office is always asking for more. They don't want to do them. What they want is they want to be compensated accordingly for completing all of these forms. It's very difficult. And then the problem becomes that it's the patient who's suffering because they're waiting for their compensation claim to be approved, but it's difficult for the physician and the compensation office.
Yeah. Interdisciplinary health team need to build some roles. Okay. And Mia also wants to know, why were the compensation claims so little?
So is that from a monetary perspective?
Yes.
Okay,
exactly.
From a monetary.
I think referencing the $3 compensation.
Yeah, so that was because of the formula that was used by WSIB to support the claim. And when the formula was taken into consideration and the participant was a smoker, the claim was cut in half. There is a formula that allows for the severity of what your COPD looks like as well. So some of the claims ranged from like $3 up until maybe $5,000. So it was really dependent on the severity of the COPD as it was diagnosed.
Comment around, there's a physician toolkit available for construction trades on the IHSA, the Infrastructure Health Safety Association website. Similarly, actually, there's a new diesel particulate toolkit available on and silica toolkit on OCAU's website. Question, is there anything that the employers or other parties can do to help workers for the WSIB claims?
Yeah, absolutely. So there are lots of folks who are willing to support and help and guide this process. Employers need to provide employees with better training. They need to have a tool that allows the employee to understand the workers' compensation claim process. They don't necessarily understand all the steps that are involved. They certainly need to provide more education. Advocacy is huge. Folks at OCAL are supportive. There are so many folks out there who are willing to support this. Union compensation representatives who go above and beyond to support anybody who's looking to submit a compensation claim. So I think that, advocacy, it needs to happen. Education, clearly at the employer level. But we talked a lot about, when I was speaking with a couple of the physicians, we talked a lot about the fact that, WSIB, when they advertise, they don't advertise about, what does it look like when you're submitting a claim? How can we provide you with more information? So they need to be revamped a little bit as well to make it easier for the party to, for the individual to be able to submit that claim.
Okay, we're almost getting there. Susan Faulkner would like to know if there's a statute of limitations on claims.
So the claim is open for as long as you're in the midst of that claim. So if the claim has been approved, that's kind of a very broad question. So I can speak to some of it, but there's limitations on some of the claims. Again, it's dependent on the illness. The severity, have you gone back to work in full? There's so many different factors that can speak to whether or not there's a statute on those claims, statute of limitations on that claim.
Okay. I apologize. I'm not sure if it's Rita Alzeron would like to know, do you believe that more robotic technology will eventually be incorporated into the industry to assist? Or, basically to take out the human.
Absolutely. Robotics are entering every mechanism of what we're doing, every field, not only in the mining industry, but certainly in every industry, including the medical industry. I had the good fortune of going underground to do and witness some of this stuff. And you know what? I mean, the technology is incredible. I witnessed, a gentleman standing back using, his remote control to operate a big scoop. And I was completely impressed by the fact that he didn't have to get anywhere near the wall where there might be an incident. So yeah, it's happening and it'll continue to grow.
Yeah. Okay, last question. Aidan Trudeau, you get the last question. Have there been any studies into the prevalence of cigarette smoking within the mining population? And if so, have they taken action to specifically target smoking cessation for miners?
Yeah, I mean, there are lots and lots of studies about smoking, cigarette smoking with those in the mining population. So my study really focused in on the qualitative component of it. But I can tell you there are so many quantitative studies that actually look at this and looking at, providing that, the importance of providing that smoking cessation. There's so many quantitative studies that speak directly to this. Absolutely.